Good morning. Thanks everyone for joining the Department of Human Services this morning. We're very pleased that you could take the time on a Friday to learn more about the DHS COVID response. As many of you know, we are a large agency that's considered an essential function, which means when others close, we don't. 85% of our budget includes direct services to clients and community partners like many of you. And I know that you've been communicating with your key programs, but we really wanted to take this opportunity to share a comprehensive overview of the efforts that DHS has taken in this response. Like many of you, we've settled into a very different way of conducting our business. And while we know that you have participated in calls, we thought it was time to come together as an agency and share the big picture. And we'll share the big picture of the agency response and also give you a little bit of information about the Emergency Coordination Center, where DHS has had a very active role in the statewide response to COVID-19. We want to remind people that today's meeting is offered online only with live closed captioning, which is different than how we've done these meetings in the past. So bear with us, give us a little grace as we work through this. If for some reason the broadcast stops, check your email and you may have a link or some instructions to rejoin, or you can check our Twitter account, which is at Oregon DHS for an update. We'll be covering a lot of information today. We will also be recording this, so you'll have an opportunity to view the materials on our website early next week. So you do not need to take rapid fire notes as we go through this information. Before we dive into the agenda, I did just want to give you a couple quick stats just to give you a sense of the responsive efforts from DHS. I think the one that has struck us the most over the first few weeks of Oregonians reaching out to us for food assistance is that we went from 13,000 SNAP applications a month to 13,000 SNAP applications a week. I think one of the responses that we're very proud of is that as our staff has transitioned to telework, we've been able to stay responsive and timely in our response to those SNAP applications. Each of the programs will hit on a couple more highlights. I just wanted to share that one for some context. So for today, I'll share a little bit about the ECC, Emergency Coordination Center, as I mentioned. Rosa Klein, who is our policy advisor with Governor Brown's office, will go through the framework for reopening Oregon from the governor's office perspective. Our director will offer a report and then have an opportunity for a brief Q&A session. And then we'll move through each of our 5 program area reports with each of the directors taking some time to share information with you. And then at the end, as we usually do, we'll create some time for a Q&A with program directors. So for the next slide, I wanted to share a bit of insight, if we can go to the next slide, about the Emergency Coordination Center. Many of us have learned new acronyms and are being trained on the fly with the Emergency Response Center, with Incident Command, and just a new way of doing work collectively across the entire state. The governor, just for some background, declared a state of emergency on March 7th. I think for many of us, that feels like a long time ago. And then on Monday, March 9th, the State Emergency Coordination Center activated as the lead for the COVID-19 response. Local and tribal emergency operations centers, EOCs, are also active. An Oregon Incident Management Team, IMT, arrived on March 17th to manage the statewide response. On Monday, March 23rd, the governor released a statement for individuals to stay at home, close certain businesses, require physical distancing for retail businesses, and that workplaces shall facilitate telework and work at home. Some government offices were closed, campgrounds were closed, and there was an effort to minimize travel. And then on March 26th, Oregon received a major disaster declaration as a direct result of COVID-19. So I share that for just a little bit of context for all of us to remember where we were and how we found ourselves in this situation. As part of the response, a multi-agency group came together with directors from the Department of Administrative Services, the Department of Human Services, Oregon Health Authority, the Governor's Office, and the Oregon Military Department. And that group has set the strategic intentions that you see on a slide before. And I'll let you read those, but really the focus has been on protecting the safety of the public, vulnerable populations, first responders, and healthcare providers, The second, mass care really is part of the DHS response for emergencies, not just COVID-19, but we are responsible for an emergency support function, also called ESF6, for mass care and feeding. So we work with partners to make sure that the food supply is protected and that people have access to food. And when there are instances where people need help with sheltering, we work with partners again to provide that. And that's well beyond our day-to-day jobs. That's a specific function that we show up and participate with our partners to deliver. In addition, the focus has also been on minimizing the impact and spread of COVID-19 to the people of Oregon. And as you'll hear from Rosa, while also looking ahead to deliberately reopen Oregon. As you can imagine, Oregon's healthcare system, and many of you are parts of that, is prepared and has the capacity to care for the well-being of those impacted by COVID-19. Again, the point of the multi-agency response was to lead a coordinated, aligned, and efficient response to COVID-19. And finally, to ensure transparent, accurate, and consistent culturally responsive communication to the people of Oregon. So those have been the drivers of that work. So just wanted to share a bit about that so you have some context. We could probably do a whole nother hour session on emergency response, but we will spare you that today and get on to the business of hearing from Rosa Klein from the governor's office. We'll have a few minutes for Rosa to take questions, which you'll submit through the Skype Q&A window, which you should see on your screen. And then from there, our director will talk about the department's priorities that we've used to manage through this pandemic. And as I mentioned, he'll take some questions as well. So with that, I'm going to turn it over to Rosa.
Thanks, Liesl. Good morning, everyone. And so my name is Rosa Klein. I'm the Governor's Human Services Policy Advisor. And today I'm going to briefly walk you through the framework that the governor's developed for reopening, the gradual reopening of Oregon as we get the COVID infection rate under control. Next slide, please. So this quote from Dr. Fauci at the national level has really been kind of a touchstone for our office, that because, you know, we are all policy nerds, we love to plan, we love to, you know, get A+ on our delivery of the plans that we create. But what this virus is requiring of us is a lot of flexibility, especially in terms of taking our cues from the public health impact that we see in our communities. So really the framework I'm presenting today, the most critical aspect of it is that it's going to be flexible. We are going to create some milestones and metrics that we can all look at and assess whether or not we're ready to move to the next stage, but we all have to be prepared that we may have to take a backwards shift as we move forward and if infection rates increase. Next slide, please. And the other touchstone that we've really been using a lot is that none of us expect to go back to the normal that we experienced prior to this pandemic. We know that there's still going to be some aspects of social distancing that we're living with longer term. And we know that particularly for the population that we all care about with Department of Human Services, there are probably some protections we're going to want to put in place that will look different longer term than what we were living with prior to COVID-19. Next slide, please. So the good news is we in Oregon have been doing a magnificent job of keeping that curve flattened. The governor was one of the first in the nation to institute a stay-at-home mandate. And so because of that, we've avoided a lot of the spikes in infections that have happened in other states and countries. And so the goal now is to maintain that kind of low infection rate that we're seeing. It's still too high. We still don't want to see people in emergency rooms and in intensive care units and needing really critical interventions to keep them alive. But it's better than it would have been if you can look at the orange line there. So that's basically, you know, once we start to open up, if we went back to the executive order that the governor issued, that's kind of what we could expect in terms of the the time for the virus to reach critical mass and growth. So great job. And as we open, what we're going to be tracking is any changes to that blue line. So as we reach each stage of reopening, we're going to be trying to measure the rate of infection and make sure that we've got that under control before we move to the next stage. Next slide, please. So the way that we're looking at this, and this is just a caveat here, I'm not a public health expert, and so there may be questions that you have related to this framework that I'm not able to answer today, but at the end of this slide deck, I've included my contact information, and I'm happy to track down answers that I don't have today. So we are working really closely with the Oregon Public Health Authority's Public Health Division, and then the Governor and Oregon Health Authority have convened a medical advisory panel to help to put a little bit more detail into some of these criteria for reopening. The basics are kind of a foundation where we want to see, we really want to understand kind of our current reality in terms of how many people are experiencing COVID-like symptoms or have tested positive for COVID. We want to see that hospitals and healthcare providers have what they need to be able to care for patients once they do become infected. And then we want to be able to track down those infections if they occur as a result of loosening up on some of the social distancing restrictions. Next slide, please. So this is part of the kind of core public health practice. Testing and contact tracing is something public health does very well. And I think what we're so lucky here that we have such a strong culture around population health. We have a lot of experience in Oregon with screening and contact tracing for communicable diseases. So you've probably most recently seen it with measles outbreaks. And then we always have ongoing contact tracing for sexually transmitted infections and other serious communicable diseases. So basically what this looks like for Oregon right now is we need to shift our capacity, some of that testing and screening over into COVID. So that requires resources in terms of people who can do testing and contact tracing, as well as the supplies for the testing and monitoring of people's symptoms. So that we need to have a really strong handle on. And then the other part, I'm sure everybody has been hearing a lot about personal protective equipment or PPE. That's something where we, at the beginning of this pandemic, we became aware very quickly that we did not have sufficient personal protective equipment for everyone who needed it. We need personal protective equipment for healthcare workers, people who are working in human services around vulnerable individuals themselves. And what we're starting to see now is we have created some capacity in Oregon to make personal protective equipment, and we've also started to order PPE to be delivered into the state. So that is ramping up, and that's really going to help us get to a state where we can start opening up. And then finally, the intensive care unit capacity. In the case that this gradual reopening does result in higher infection rates, it will, ultimately result in the need for more intensive care unit capacity, which we have, fortunately, in Oregon. So our hospitals and public health authority have been working really closely together to make sure that we have that capacity. Next slide, please. And then finally, for preparedness for phase one, basically, we're going to be asking for plans. This is the regulatory function of government. We're going to be making sure that employers and people who have areas where you're going to be having the public interacting in close quarters, closer than they are now, but hopefully not as close as we were before. We still want to see social distancing, that we have plans in place for how to protect people's health, both from a sanitation perspective, physical distancing, and then just basic kind of consumer advice. So how do we make sure that people have what they need to keep themselves and families safe? And then monitoring, I don't know, there'll be some population level monitoring that will be released fairly soon. Next slide, please. And then so phase one is basically kind of the start. And once all of the previous criteria that I mentioned are in place, then the governor will designate that phase one begins. And this will be different across the various geographies of Oregon because our communities have different needs. So phase one may be able to begin sooner in some parts of Oregon than others. And I'll next, if you cut to the next slide, I'll show you kind of the framework for phase one. So phase one, we're looking at kind of some of the same practices that we have now. We want people to keep washing their hands, keep using face coverings in public, and then staying home if sick. And then really, for many employers, what we're hoping is that they'll be able to continue having people work from home. If it's possible to keep people in their households, we would like to see that. And then for employers that do have people gathering in the workplace, we want to see appropriate physical distancing, sanitation, and PPE. Next slide, please. So, and then for phase one, another aspect, so for people who are at high risk, and we're starting to really understand what those high risk categories are, we're still hoping and expecting that for those very high risk individuals that their situation in phase one won't change much. I know we're asking a lot of people in terms of the physical distancing, and it can be isolating. So as we are able to open up, we're hoping that people who are at a very high risk of infection will bear with us a little longer until we can open up more completely in congregate care settings and settings where there's lots of folks who are more vulnerable. And then some of the key numbers here are still under discussion. So for instance, the groups of 10 is still under discussion. I think we're looking for some public health guidance from the medical advisory panel to give us a sense of whether or not that's the right number. And then really minimizing non-essential travel. I know there's a lot of concern from some parts of Oregon that have low incidence rates right now, that once we open up again, people from other areas who have higher rates will start coming in and bringing the virus with them. Next slide, please. So if you look at the state as a whole, you'll see that we have a wide variety of both incidence rates and preparedness across the state in terms of what people are able to do in their hospital systems and with testing and contact tracing. So it'll be dependent on each region's capacity to open up. Next slide, please. And this is another aspect of opening up that's still being considered, and we'd love to get some feedback on this, specifically from the group that is hopefully listening today. What we're proposing is a process for a county to request from the governor to open back up, and that would look like kind of everyone in that community standing together, looking at one another in the eye and saying, we're ready for this. You know, we have what we need to keep people safe. And if there is in fact a surge, we have what we need to take care of people who are sick. So we want to make sure that we have the right considerations in that process. Next slide, please. And then phases 2 and 3, this is also an area where we really need a lot of input from various industries and communities, because phase 2 and 3, we're not looking at it as a linear trajectory. Basically, we're looking at phase 1, you know, how are we doing? Are infections increasing? And really, this slide says wait for 14 days. It's looking like it's probably longer than 14 days before we will know the impact of the less stringent physical distancing on the population. So we're expecting that as we open up phase 1, we may have to go, or open up, sorry, phase 2, we may have to go back to phase 1 and have stricter social distancing requirements. And for mass gatherings, that is another area where we're really trying to get as much input as possible. People have plans for the summer, and we need to issue some guidelines around what we need to do around mass gatherings to keep people safe. Next slide, please. So that's what I have today. If you have questions, please send them in the chat and I can try and answer them now. If you have questions that are going to take more of a longer discussion, my email is posted here, and you can send them to me that way. Otherwise, that's my phone number. Give me a call if you have any questions or concerns that you think the government needs to be aware of. I am just really grateful to be able to communicate with all of you and to have such a good team at DHS to work with. So thanks very much, and I'll take any questions.
Great, thanks Rosa, super helpful. And we do have a couple questions for you that Christy's going to read off.
Here's the first one. When will the revised Oregon Crisis Care Guidelines and any COVID-19 related modifications be made public?
So the crisis care guidelines are an Oregon Health Authority set of guidelines, and that I have an update from Public Health that's a little bit old, so I will get a kind of the latest from Pat Allen at the Oregon Health Authority, and I can share that with Christy. Can I send it to you?
Yes.
Great.
Great. Any more?
Yes.
Okay.
More. What does gating criteria mean?
Gating criteria?
Yes.
So I think it's a project management term that comes from the IT world. I think it's like a stage gate process, and it's you know, if you think about a trajectory where you're going to go part way, hold people there, and then maybe open the next gate, let people through to the next part of the path. That's how I think of it. I'm not sure where the term comes from.
All right, one more.
Given that all vulnerable individuals will be asked to shelter in place while others will be able to slowly get back to normal, what sorts of special accommodations or supports will be in place for those folks? How is it determined who falls into those vulnerable categories?
So the category of vulnerable populations that the federal government is using is slightly different, I think, than what we would like to see here in Oregon. So I have actually that definition. Christy, I can follow up and send that to you, but it's mainly focused on people with specific underlying health conditions and then age-based parameters. I think what we anticipate is, you know, the tools that we have to use to fight this illness are contact tracing, testing, personal protective equipment, and physical distancing. So in as much as vulnerable populations need special access to those tools, I think that's what we would be using. We don't have specific plans in place now other than what the programs at DHS have developed. But I think you can get a little bit more detail about the specific populations related to aging people with disabilities, ODDS, child welfare, and others. So I'm sorry, I don't have a very easy kind of clear answer to that, but I would like, I've been getting a lot of really good suggestions, recommendations, and requests from people who are considered vulnerable populations or people who work with vulnerable populations, and that's always really helpful. So as much as you can continue to send those to me and advocate for what you know is needed, we can work it into the emergency response plans.
Thank you, Rosa. I think we all talk about PPE more than we ever thought was possible. So keep the questions coming. We can't promise delivery, but we need to know what the demand and need is. So please, you're not a shy bunch, but please don't be shy about making those requests of us, and we'll be as responsive as possible. Rosa, thank you. That was so helpful. I think you're obviously welcome to stay on the rest of the presentation. And with that, I'm going to turn it over to Fairbors.
Good morning, everyone, and thank you for joining us. Last time when we had our stakeholders meeting, we had anticipated that that would be our last stakeholders meeting in the Human Services building. We were planning to get on the road and come and see many of you in your own communities, but I guess, as Bob Dylan once said, life is what is happening when you're making plans. We had no idea that we would be in this situation a couple months down the road. And I can tell you that I have worked for the state for 30 years and seen many different things. We've gone through floods, we've gone through disasters, earthquakes, strikes, etc. But this is something different. Those other things, what they had in common was that there was always a beginning and an end that you could define, and then you would get into recovery mode. And with what we're in, we really can't see 2, 3, 4 months down the road. We all keep our fingers crossed that this will be over in a few months, but what we're hearing is that it can be going on for 24 months or longer. So what we're trying to do in DHS and across the state is to adapt and to innovate and to do better while we're going through this. And if you actually go back to the previous whether there was a flood or there was an earthquake or there was anything else, DHS offices generally will have to stay open because we do have a group of population that don't have access to the web, they don't have access to technology, and the only way that they can receive their services is to walk into our offices. And because of that, we have over 100 DHS offices open. They've been open throughout this pandemic. And there's been a steady group of service recipients walking through the doors, and our staff have done an admirable job serving them. What we're trying to do here is to try to balance and comply fully with the governor's stay at home, be safe order, and at the same time, and naturally, because of our offices are open, maintain that physical distancing and still deliver the services that we need to deliver. And as we begin to see people lose their jobs, staying at home, etc., the demand for our services increase. So one of the concerns that we have is the population that we have in residential facilities, particularly in long-term care facilities. You may know already that more than half of the fatalities in Oregon as a result of COVID-19 is in long-term care facilities. So that's a huge area of concern for us. I think the agency has done an admirable job with the help of partners, hospitals, etc., to manage the situation. Mike McCormick will talk about that in more detail, but again, that remains to be an area of concern. The other thing that we're really worried about is how many people are losing their jobs. The latest figure indicates that 360,000 Oregonians have lost their jobs. Some of these folks have never had to rely on public assistance, and we're seeing them now connecting to us via the web, in our offices, etc. And it's not easy for someone who's been self-sufficient to now have to request services. And we are working through that. These are very different and unprecedented times. One of the things that we are also keeping our eyes on is our providers. DHS cannot do the job that we do for 1.5 million Oregonians without the provider network, whether they are individual providers or residential providers. They are suffering through this pandemic as well. either because of not receiving referrals, so their revenue has gone down, or in residential facilities because of COVID-19, having fewer staff that are showing up to work, having difficulty maintaining staff, incurring additional expenses, etc. So those are the challenges for our providers as well. We are asking the public to help us check on our children because of the situation that we've been in. We have seen a significant reduction in calls to child abuse hotline. We know that abuse and neglect are occurring across Oregon. We are just not hearing about them. And now we did see an incremental increase just over the course of the past couple of weeks. And again, we are hoping that as things begin to open up, we'll get a better sense of what's happening with our children that we need to be keeping an eye on. We're also seeing a decrease in the number of calls to adult abuse hotline. We're seeing an increase, on the other hand, with people wanting information. How do I access services? How do I get help? Etc. Let me talk for a moment about the budget impact of COVID-19. Just last week, I think it was last week, I'm losing track of time, the emergency board met, and there were very few items on their agenda, primarily dealing with the impact of COVID-19. DHS was granted $3.5 million general fund as a result of that process, and it was for very specific items. A program to reimburse providers and workers for COVID-19 test costs that are not covered by insurance. The requested amount would fund about 15,000 tests, 15,000 to 30,000 depending. So the higher amount of that, the ceiling of that is about 30,000 in the near term. And for context, we have about 40,000 home care workers, personal support workers in Oregon. We are hoping that those amount of tests would be sufficient to take care of the needs when and if it arises. There was also funding for development of a specialized training in infectious disease controls for COVID-19, with funds dedicated to Oregon Care Partners, which currently provides state-funded training for family caregivers and care professionals who provide care, services, support, and resources to older adults, and also long-term care workforce trust, a workforce training entity to target training to union-represented certified nursing assistants, or CNAs, working in nursing facilities around the state. This constitutes approximately 50% of the statewide CNA nursing facility workforce. So again, training, testing, and specifically training on infectious control, because that is so primary in the times that we're facing now. Now, what's the state budget outlook? We get our funds from, all of our funds come from tax revenues, etc. If people are not working and they're not paying taxes, very few dollars are coming into the state coffers to fund these services. The governor just this week announced that she has instructed all the state agencies to take, this is an exercise for the time being, an 8.5% reduction in their budget across the board. And that 8.5% actually translates into more than 8.5%. Why is that? Because we are already 10 months through the biennium. And by the time we get to phase one and we begin to see some of these industries coming back to work, and again, wages are paid, taxes are paid, income is generated, we'll be halfway through the biennium. So you can generally double that number, and that would be the anticipated reduction that state agencies would need to take to manage what we know today. And we will know much more when the revenue forecast is released on May 20th, and that will create the baseline for what we need to do and what we have to do in order to manage the state's budget, because as you all know, the state cannot run a deficit as the federal government can. We have to have a balanced budget at the end of each biennium. Now, there is money that has come into Oregon. You've heard about the CARES Act, but there is a criteria in that act so far, and there are conversations that perhaps to change and modify that money cannot be used to backfill the loss of general funds. That money is specifically dedicated to COVID-19 issues. There are some other funds that the state, the Corona relief funding of about $1.6 billion. And I can give you a few different areas that fund can be used for. We've seen an increase in our FMAP, the federal Medicaid percentage that has been an increase of 6.2% for at least 6 months, and it could be more than that if this pandemic lasts longer than that. But that actually is money that DHS can use to fund specific items such as not the FMAP, but actually the Corona Relief Fund. Increase in congregate meals, increase in home delivered meals. All of us know that many of our aging population are not able to leave the home and go to where they used to go to get lunch in groups, etc. So now meals are being delivered to homes. And then also the additional funding in Title 4B, which is used for childcare. As we are continuing our work, we're checking with the Office of Chief Financial Office, the State Chief Financial Office that resides in DAS, to get a better sense of what this Corona Relief Fund can specifically fund across the state, and how much of that can be used for DHS. Ultimately, as we begin to get into phase 1, we're going to be opening some of our offices. We're going to continue to do teleworking as much as possible, because the fewer contacts, the fewer possibilities of spreading this virus. Some of our offices, and you'll hear about that, have done a very good job of delivering services while working remotely, not from their offices, from home. And to the extent possible, we'll continue that. I did want to just share in closing some good news with you. There's some really heartwarming stuff that's happening across the state. There is a nonprofit organization, the Contingent, that used to be the Portland Leadership Foundation. You may have heard of Every Child. And Rebecca may talk more about that, but they started 6 weeks ago this initiative, My Neighbor Project, and they have met 500 requests for assistance from our foster parents, ranging from diapers to bicycles and laptops. In my own neighborhood, there are a group of people that are sewing face coverings and have donated several hundred of those to DHS staff who have face-to-face contact with residents and clients, and also kids. There are also other communities, sewing guilds, that are sewing these face coverings for our DD providers in residential setting. So to close, I'd say that this pandemic has brought us together, and together we will emerge from this. That's the only way we can be successful. DHS cannot do this alone. We need the help of the community and need to help each other as we get through this. Let me stop there and see if there are any questions.
Yes, there are a couple. Can you address some concerns around PPE, particularly for staff who are working with first responders? Is there an opportunity for them to be considered first responders so they are prioritized for PPE? And providers are also struggling with acquiring PPE and are wondering if there is any advice for them.
Yes, I don't need to repeat the questions, right? Yeah, folks have already heard that. Okay, the PPE situation is actually loosening up. There has been a shortage of PPE across the nation and really worldwide. But as just within the last 2 weeks, we are anticipating, we actually got one shipment in and there are additional PPE that is coming in. From the very beginning of this pandemic, there had to be a prioritization. When you don't have enough of anything, then you basically prioritize based on who's tier 1, who's tier 2, who's tier 3. Tier 1 has been our healthcare workers, those who work in hospitals, those who work in COVID positive facilities, etc. And then the next tier are law enforcement, some of our own staff, child protective services, people who work for adult protective services that go into the facilities. Some have received some PPEs to the extent possible. You know, some of our partners have been very generous sharing those with us, law enforcement in various communities. But I'm very optimistic that within the next week or two, we are going to see many more numbers of the PPEs come into the state. Additionally, as I just shared with you, there are communities now standing up. And as we begin to bring people back to work, part of trying to avoid spreading this virus is these face coverings. So I think together we can manage this and we can get through it and hopefully do better as we move forward. Was there another question, Christy?
Yes, regarding budget,
Mm-hmm.
will existing DHS service contracts be impacted by the 8% budget cuts, or will this only impact future contracting?
The answer to that question is that it depends on what the level of the reduction needs to be. If we are committed to a contract, we can't just, eliminate, let's say, labor contracts. We can't just unilaterally stop that contract. There has to be some negotiation. But if there are contracts that are coming to an end at the end of the fiscal year, the federal fiscal year, and then they need to be renewed. Those are the kind of things that we need to look at. Ideally, we don't want to stop contract, but we know that we are not living in the ideal world. And because we have to balance our budget and because 85% of DHS funds goes out to contracts, to providers, etc., it forms a major part of our budget. I should also share with you that for every $1 that we eliminate in general fund, we also lose $2 in federal funds. So, the impact is significant both to us and our providers. But, if there are already contracts in place, we'll honor those contracts unless those contracts are expiring. Thank you. Thank you again for being with us. I'll turn it back to Liesl.
And actually, I'm going to turn it over to Dan Hahn, who's our self-sufficiency director, who will launch our director updates. Take it away, Dan.
Thank you, Liesl. So thank everybody for being on the call today, on logging in. The last couple of months have obviously been very stressful. Not a day goes by where we don't have surprises that get to us. Most of those surprises have been negative. But today we got a good surprise, and that is my boss quoted Bob Dylan. I didn't think I would ever hear Fairbore's quote Bob Dylan. So that's amazing. As this crisis kicked off, we got into COVID-19. I think the biggest challenge self-sufficiency faced was that balance that I believe Liesl talked about, of protecting our staff, honoring the stay-at-home order, while recognizing the fact that some of our clients, some of our participants, some of the people who need our services need us and need us in our buildings so they can access those services. So one of the things I'm incredibly proud of Self-Sufficiency and DHS for being able to accomplish is, first and foremost, really building a robust telecommuting community for our staff so that we are able to meet the needs of our clients while working from home. I think that getting over 50% of our staff telecommuting in the first couple of weeks was quite an accomplishment and quite a demonstration of our dedication. We also have plenty of staff who are volunteering to stay in the offices, who are willing to stay in the offices, meet our clients face to face, and meet those needs. So really proud of the work our staff did in doing that. And one would assume, of course, during that time that we sacrificed the timeliness of our benefits and getting our benefits out the door, especially when you think about the fact that, as Liesl said, we were seeing almost a 400% increase in our applications, seeing almost 13,000 applications a week in SNAP benefits. And as of yesterday, I'm proud to announce that we are 95% of our applications are being processed and completed in 4 days or less. So we're able to meet the need of customers, get the benefits out the door, and get the much needed resource out into our community. I think in addition to that accomplishment, we were definitely saddled with multiple challenges. Initially, we only had applications online for our OHP programs and our SNAP programs. The staff worked diligently to update our applications so that we were able to also accept online applications for SNAP and for SNAP and for TANF and employment-related daycare. So that was another thing that I really think that the staff were able to do. Obviously, unfortunately, we were not able to get where we wanted to get around getting those applications out in multiple languages, but we were able to overcome a massive phone issue as we moved all of our staff out of the offices, or the majority of our eligibility staff out of the offices. They were able to historically take applications on the phone for individuals who did not speak English or Spanish, because our CAPI, some of our applications are in Spanish. We were able to overcome a phone issue where we're able to actually take applications from people's houses, from staff members' houses, and meet that need for that population as well. On the slide in front of you, I believe you can see some of the policy changes we were able to make during the last several months that have increased our ability to serve our customers. Some of the ones that I think we are proudest of in the self-sufficiency program that helped us to alleviate the workload while maintaining benefits for individuals was being able to waive some of our interviews so that when information was not needed, so that we were able to get people benefits without having to make that phone contact. We were also able to move to phone contact for our interviews, being sure that we're able to meet the needs of customers who had access to the internet and who had access to a phone. We were able to do that to keep them safe so they didn't have to come out of their homes and into our offices. We were able to work with the employment-related daycare program and early learning division to increase the income limit for individuals receiving employment-related daycare, to make that an easier process for individuals. So we were able to move that up to 250% of FPL, the federal poverty limit, or 85% of the state median income. We've also been able to waive copays for families receiving employment-related daycare. For anybody who's worked with the employment-related daycare program or with clients in the employment-related daycare program, you're very aware that copays have always been an obstacle for families to truly benefit from that program. During this time, we were able to waive all of those copays for individuals who were receiving employment-related daycare benefits. So for our essential workers and our critical workers who needed to be in their jobs, and whose kids were perhaps at home rather than in school, we were able to get them that additional support. We were also able to, over the last 3 months, extend recertification periods for SNAP recipients so they wouldn't have to reapply or get recertified for benefits. Obviously, that makes a huge difference to individuals who are up for recertification and who are dealing with this crisis and dealing with the stress of this crisis. They were able to not focus on worrying about their benefits, but were rather able to focus on keeping themselves and their families safe. It also had a massive impact on our workload, which allowed us to continue to meet that flood of additional applications. One of the, I think, biggest and most important accomplishments that we were able to achieve in the SNAP program came in this morning. We got good news this morning that we were approved for pandemic EBT. So that is a wonderful news. Many of our advocates, many of our partners, many of our legislative partners and the governor's office have been working with us and helping us get that waiver, get that additional food benefit for families. It has been a very hard benefit to get. It requires a lot of technology solutions, a lot of coordination with early learning division, as well as with the school districts, and we got that final approval this morning. So I don't have a whole lot of details on what it'll look like rolling out, but I will tell you that what it means for Oregon is that we will provide approximately an additional $134 million in additional benefits for over 351,000 children in kindergarten through 12th grade. Those students, if they were in school, were accessing free and reduced lunch program, will now get that additional benefit on their SNAP cards. SNAP EBT cards. For those families who aren't eligible for SNAP or not receiving SNAP, they will get an EBT card with those benefits loaded. Our hope is to roll that out by the end of May, beginning of June. The amazing thing about this program is while we know schools have had to shift and many schools are providing lunches, bagged lunches for families, for kids, that program will not go away. So families will have access to that program in addition to these new EBT benefits for pandemic EBT. So that is just one thing that I think is an amazing benefit for Oregonians as we go through this crisis, and one that seemed like it should have been an easy for us to achieve, but it has been a very difficult waiver to get because of the technology that is required to do that, as well as that intercoordination between school districts and education in general, and a relationship that in normal times is easy to do, but during this time is actually incredibly difficult. So very proud of that. Before I sign off, I do want to say, as we've watched, something that did also surprise us this week. We expected to see, obviously, an initial increase in SNAP benefits as individuals were losing their job. We expected that the TANF application increase would happen over time. The caseload increase would happen over time. Looking at past recessions, there's usually a lag in the TANF population. However, for the last 4 or 5 months, we've seen an average of about 1,500 new cases on TANF. For the month of April, we saw over 3,200 cases. So that caseload is growing sooner than expected. And it's one that may be tied to unemployment insurance difficulties, as families don't have that income coming in. But it's one we're definitely keeping an eye on as we move into the next phase of this reaction to the coronavirus. So I am over my time. I'm going to go ahead and kick it over to Mike. Mike is a director, Mike McCormick, the director of APD, the interim director of APD, who I have to say has been the most amazing individual during this crisis that I've ever had the opportunity to work with. The mountains he has moved to protect seniors in our community has been just absolutely phenomenal to watch. He deserves a lot of credit, and I'm going to kick the mic over to him and let him do his presentation.
Thank you, Dan. You choked me up. I wasn't expecting that, and I certainly don't always feel that way, but I appreciate the kind words. I can't say enough how stressful and emotional these past 2 months have been for the APD staff, all of our partners, our providers, and the employees that we serve. You've seen on the news the devastating impacts that COVID has on the population that we that we care for so much in our hearts. That's why our strategy, starting on February 29th, was to focus all of our efforts on prevention. If we can keep the virus out of these facilities, then the negative consequences aren't going to occur for these individuals. So what did we do? We started in February 29th by allowing facilities to impose restrictions on visitation where appropriate, because the residents in long-term care facilities do not have the virus. They need it to be introduced into their community. So how does it get introduced? It gets introduced through staff, through vendors, through healthcare providers. So we encouraged, strict visitation policies that allow screening for signs and symptoms, eventually getting more strict over time. Our staff went out and visited almost, so we have 677 of our large congregate settings in Oregon, and we were able to do in-person reviews of just under 670 of those during the first week of March. We issued policy direction to our long-term care facilities that when you have a suspected case or when you have a confirmed case of COVID in your facilities, you are required to report that to the licensing office. And when you report that, we issue what's called an executive order. You may have heard the long-term care facilities have EOs, executive orders on them. Well, what does it mean? Well, it requires them to restrict visitation. Obviously, it requires them to restrict any new admissions, so we don't want new people coming in and potentially being exposed. It requires them to isolate the suspect resident where possible, or if it's in the case of a staff, to not allow them to work. It requires infection control training, and it requires the elimination of all congregate activities. The executive orders were generally well received by the industry. They recognized that COVID has a devastating impact on the community that we serve and supported the agency's regulatory efforts to impose these strict measures. Obviously, as I said, one case is too many. The newspaper stories on these have been heartbreaking by the victims of this horrible virus. I'm pleased to report, however, that out of our 677 facilities, only 25 of them have a confirmed positive resident or a confirmed positive staff. So for context, that's less than 4% of all of our large congregate facilities. We wish it was zero, but I'm happy to report that 96% of our facilities are COVID-free today. In our adult foster homes, they're doing wonderful work as well. Only 7 of them, or less than 1%, are reporting a confirmed case today. So the PPE shortage is kind of starting to resolve itself now. So we're kind of changing the way that we're approaching this crisis. Starting this week, we began sending our surveyors out to our long-term care facilities. We were able to provide them with the necessary personal protective equipment so that they weren't inadvertently infecting other people. They'll be reporting back on how they're doing isolation, how their infection control procedures, how are their staffing levels, all of that stuff. We also were able to recruit We found a lot of situations where, what do we do when a facility is in crisis, or what do we do when someone is in the hospital, they are COVID positive, they are ready for discharge, but they don't have a place to go? So we developed two emergency healthcare centers, EHCCs. Currently, we have Laurelhurst in Portland and Pacific Health and Rehab in Tigard that are contracted with us to serve the long-term care needs of individuals who are COVID positive. That's a total of 97 beds. So as of yesterday, late yesterday, Laurelhurst has filled 41 of their 47 beds, and Pacific, which just opened, is serving 16 of their 50 beds. So the demand is there. They're providing tremendously valuable service to the community, and let's hope that that ultimately proves a successful strategy. So let me also talk about what we're doing programmatically outside of our long-term care facilities. As Fairborse mentioned, we did receive additional funding through the CARE Acts for our meal sites, our wonderful meal providers that were providing congregate meals to hundreds of thousands of seniors every year. They had to close down because of the risk of COVID. So they've been really upping their game and delivering home delivered meals. Our latest statistics show that there's an 80% increase in the referrals for home delivered meals compared with the same period of last year. Our providers are just doing God's work out there, preparing these meals, getting them out to the seniors who depend on them, not only for nutrition, but to have a friendly face who delivers a meal to them when they're in this state of isolation. We made the difficult decision to close our adult day care centers. They're a wonderful resource that we're serving older adults for 4 to 6 hours per day. They were getting ADL assistance, they were getting health assistance, they were getting socialization. We had to close it. It was just too risky, but they're such a valuable part of our infrastructure, our long-term care infrastructure in Oregon, that we are providing temporary financial support in the hopes that they will be available when this crisis ends. On the provider side, we've taken a lot of actions, not only to preserve our existing provider base, but also to be able to recruit new providers into our system. So we've extended all the deadlines that you would expect us to extend. Like, or how long does a home care worker have to complete their orientation? What do we need to do in terms of modifying our background check procedures to ensure everything is running efficiently and is not putting people at unnecessary risk? We also extended automatic termination dates for this group of providers. As Fairborse mentioned, we are, most of APD's budget is funded through Medicaid, and specifically through the 1915K Community First Choice option. As part of the first stimulus bill that was passed, we get a 6.2% additional match on all of those expenditures. But one of the conditions for receiving that funding is that states need to suspend all adverse actions in Medicaid. So what's an adverse action? Well, it's about eliminating someone from service. They failed to submit paperwork. You can't cut them off under these things. You also can't reduce the benefits that they're receiving. The objective of that first stimulus bill is absolutely admirable. People don't need to be worrying about losing their Medicaid coverage in a crisis like this. And the 6.2% is a great tool to allow states to continue to do that. As Fairborse mentioned, one thing we are extremely concerned about is our referrals to our adult protective services is down by 23%, and that's not right. We know that abuse of older adults and people with disabilities is not down by 23%. We just know that there aren't enough eyes on them to ensure that all of that is being reported. And finally, our Aging and Disability Resource Connection has handled a 32% increase in phone calls and a 13% increase in information and referral contacts. So in closing, I just want to recognize all of the efforts of our APD staff, our AAA staff, our provider network, all of our partners, all of the OHA people who've assisted us through this, all of DHS leadership. It has been a really stressful and intense period that we've been living through, and I could not be any more grateful for how everyone has stepped up through this crisis. And now it is my honor to hand the microphone over to Lilia Tenenty, who is the director of our Developmental Disabilities Program. Thank you.
Thanks, Mike. It is an honor to have you hand that over to me. Thank you. Good afternoon, or actually, yeah, good afternoon right now, everyone. Thank you. I'm here to talk today about the work that's been done in the Office of Developmental Disabilities and with all of our partners and provider agencies and individuals and families to help keep people with intellectual and developmental disabilities safe during this difficult time. We're seeing now data coming out of New York, and we are seeing different reports and academic articles that are being produced that indicate that people with intellectual and developmental disabilities are at higher risk of complications if they contract COVID-19. And so the way to keep people in our system safe is to socially distance, continue the restrictions that we've put in place on visitors to our residential settings, and ultimately just ensure that everyone who might be coming in contact with a person with an intellectual developmental disability is taking appropriate precautions and understands that this population is at potentially greater risk for negative outcomes as a result of contracting the virus. We have been issuing guidance to our providers, our CDDPs, our brokerages, since early March. We have a website. If you go into your favorite search engine and type in Oregon ODDS COVID-19 information, you'll get to our website where we have posted everything. We have links to the OHA information. We have information on that website for families, for individuals served, for CDDPs and brokerages, and for our provider community. Some of the things that we've most recently posted and put together is a document that's really important for people with intellectual and developmental disabilities and their families to read and to use. It's about the rights that people with disabilities have when they are seeking medical treatment. It provides information just ensuring that people know that they have the right to the same kind of medical treatment as anyone else. They have no obligation to sign papers in a hospital that they don't want to sign, and that they should talk to their families and their caregivers prior to potentially needing to go to the hospital to ensure that everyone on their team knows their wishes in the context of how they want to receive medical care and what their priorities are for that. So I think that's an important piece of information that we put out. Just understanding some of the things that we have been seeing happening. We also, as Mike talked about in the APD system early on in this process, we closed our congregate day programs and our congregate employment path settings and offered some funding to those providers to make their staff available to help in other service areas. And we created a staffing resource for both CDDPs and brokerages and our provider agencies to contact to get information on staff that might be available to help if they are experiencing a shortage. So far, that's been working well with those entities that have contacted us and requesting that support. That's both for families who receive in-home services and for provider agencies who might need staff in a residential type setting. One of the things that we did recently that I think is, in the midst of all of the things that we read in the media and the negative information that's coming out, one of the things that we did was we asked our stakeholder groups, our providers, our partners, to share with us creative ideas, things that they have done or have seen done that have helped people with intellectual and developmental disabilities during this time. And we've gotten a lot of great stories and ideas. I'm just going to share a couple with you. And our intent is to put this information out so that other people are aware of it and know it and can also replicate it. We have one family, when their family member talks about something they want to do that they can't do right now, they're putting together a coming soon in 2020 calendar and putting all of the things that that person wants to do on a calendar for the future. We have a family who asked, they have a child in a residential placement, and they asked all of their distant family members to send that child information, a box, a care package with things in it that helps the child understand who they are in their family. And that's been very popular. And as a result, that child has learned more about their distant relatives than they had known before. We have provider agencies that are bringing groceries to staff. They understand that they want to keep their staff safe. And one way to do that is to help staff stay out of places like grocery stores. And so they are bringing groceries to staff. We have OSU in Linn-Benton County is offering internship credit for students who might have lost internships because of all the closures. They can now get internship credit for engaging remotely with people with intellectual and developmental disabilities in those areas who are isolated right now because of the different visitor restrictions in their homes. We also have our CDDPs and brokerages using remote tools to connect with people and continue the monitoring work. As Mike said, we are also seeing a decrease in reports of abuse, and we've reminded all of our providers that they are mandatory reporters and are really looking at ways to ensure that we can keep people safe. And one of those ways is continuing our monitoring requirements for our CDDPs and brokerages, but shifting how we're doing it to remote or through a window or other ways that don't involve direct contact with individuals. We are doing, for people specifically interested in more information on what ODDS has done, we're doing a webinar for our stakeholders on May 7th at 11 a.m. And we expect with that to answer additional questions. I'll hit some of the big ones real quick before I turn it over. We are waiting for approval from CMS on contingency funding for our providers that will allow us to continue that in the future. And we've also issued guidance expanding our family support program that I know has generated a lot of interest because we're allowing people to use that to access resources they may not have been able to access when they have their children at home now because schools are closed. So those are just some general ideas of things we're doing. And I would encourage anyone who's interested in more to join our other webinar. And at this point, I will turn it over to Keith Ozels with vocational rehabilitation.
Thank you, Lilia, and thank you everyone for being here today. Again, my name is Keith Ozels, and I'm the Director of Vocational Rehabilitation, and our mission is to assist Oregonians with disabilities to achieve, maintain, and advance in employment and independence. And as you can imagine, this pandemic has had a huge impact on all Oregonians, and specifically Oregonians who experience disabilities. But I'm glad to say that on the same day that Governor Brown issued the Stay at Home and Save Lives executive order, we were able to move our staff to almost 100% virtual service delivery model in the program, and to be able to preserve the health and safety of our staff and clients, and to still have that continuation of service delivery to our clients. And I'm extremely proud of our staff and what they've been able to achieve over the past month and a half, and being able to do outreach and maintain contact with our clients and help them navigate some of these complicated systems that we're dealing with right now with unemployment, and then being able to access other programs like my colleagues have talked about today with SSP and also with ODDS and what Lilia just highlighted. And they've been able to work with them and provide guidance and counseling and support to help them focus on the future and not focus on where we are just today, but help them deal with today, but then be able to make plans for the future and be able to help them through that. And in doing that, we've been reaching out to our stakeholders to provide them with resources and information about our current service delivery model. And we've created a web page on the VR website that outlines a lot of other exterior services and resources that they can utilize while they can also continue to receive our services virtually. And in addition to what we're doing with our direct staff working with our clients, we're also working with our vendors and contractors to deliver virtual services. We have our pre-employment transition teams in over 120 school districts around the state that are continuing to serve students with disabilities and being able to provide them with that vital transition service to focus on when we come out of this pandemic and how to continue developing those skills for those individuals. And at this point, we are moving into a new phase. Obviously, as we're looking at the opening up of the state, we're planning for that reemployment phase, and we're partnering with all of the workforce systems within Oregon and with our federal partners to make sure that we can respond to both the individuals who experience disabilities need to get re-engaged in employment, to be able to get re-engaged into an independence in their communities, but then also working with our employers throughout the state to be able to help them diversify their needs in hiring people with disabilities and being able to help them overcome some of the new barriers that we face in this environment. So we are extremely happy to be at this table with all of the colleagues and programs within DHS to partner with everyone and really to be able to continue these services. And with that said, I am going to close a little bit early. I think that we're running a little bit late, so I'm going to turn this over to Rebecca Jones-Gaston, who is the Director of Child Welfare. Thank you.
Thanks, Keith. Hi, everyone. I'm going to run through this very quickly because I know there are a lot of questions coming into the chat. So for child welfare, the first thing that we did was move our hotline staff to be remote. And that was a pretty great feat that we're proud of because we were certainly not sure that we were going to be able to have that. So most of our hotline staff are actually taking calls in their homes. We have seen, as Fair Boards mentioned, a dramatic decrease in the number of calls coming to our hotlines. And so we've been in communication with the Department of Education, with our self-sufficiency partners, with community partners, really around all sorts of different ways that those of us who are interacting with parents and children are able to check in on the well-being of kids just to ensure that they're safe and okay. We still are responding to calls where there's concern about safety. And so we have staff that are going out to homes and doing assessments. We've tried to make as much of the work virtual, but there are some things that we still have to do absolutely in person. We made some slight changes to our child parent visits where we stopped having visits in our offices and then really have our staff working with foster parents and parents to really navigate being able to, where people are comfortable, support having visits in the community with all the social distancing considerations being made, but also if people are concerned about safety, then it's facilitating virtual contact and as frequently as possible. And we've heard from a number of parents that it has been an opportunity for them to have more contact with their children while their children are in foster care. We are also still certifying foster parents so that we can have family members certified to care for children as needed, as well as continue to build our resource of foster parents. We're working to have technology available so that foster parents and children have access to what they need, but also that our parents have the ability to be able to have those virtual visits and be able to participate in any telehealth opportunities there. And that's where, and you heard Fair Boards also mention this, our partnership with Every Child, who has been phenomenal in really being a resource across the state for our foster parents and being able to meet the needs across the gamut of what those caretakers are needing. Our partners have been phenomenal. We're working really closely with the courts and the legal community, our providers, and trying to navigate this, the fact that we can't be together. So courtrooms are closed, but courts across the state continue to do some virtual proceedings. And so really emphasizing that we want to continue to support reunification and continue to support placement stability where we're able to. OHA has been a partner with us as we try to navigate and ensure that as we are making adjustments to policy, that we are doing it in lockstep with them. Our program managers across child welfare have been hosting weekly, if not more frequent, calls and updates with our partners so that we can continue to provide updates as they happen moment to moment, but also continue to get feedback about where things maybe aren't as clear or where things are changing and we're needing to be nimble. Every Child, as I said, has been a great partner. KEEP is providing support groups virtually to our foster parents, and we have our Parent Advisory Council and Parents Anonymous still providing online virtual supports to parents, whether or not they're involved with child welfare or not. Our workforce, as has been stated several times, is still doing the work. We've navigated being able to move remotely, and absolutely something that we're thinking about as we make adjustments in transitioning away from the transitioning out of the stay-at-home and really figuring out where the places that we might want to actually continue a practice of some flexibility of whether or not folks are sitting in brick and mortar offices or not. I know there are lots of questions about funding and service contracts, and we have made the request to the Department of Administrative Services about the SPRF contract specifically, and we're hoping to be able to hear once the forecast happens later this month of being able to give definitive answers in regards to what the impact of our dynamic fiscal environment is going to have on our ability to renew, continue, adjust contracts for services. And so we will continue to be communicating about that as we learn. I think the last thing that I'll do in wrap up is really just kind of plant the seeds with folks about, we're oftentimes talking about going back to normal. And my position really is that, normal wasn't really working for us in general or working for our families and communities. And so what is it that we want to create and shape for as we move forward and take the lessons that we've learned in this unusual circumstance and really craft a system and network of community that are supporting families and children in some new and creative ways. And with that, I will turn it back over to Liesl.
Narrative, so thank you for that. We have a lot of questions, so what we're going to do is do one question by program, and we'll start in the order that the directors presented, so that's just a heads up to all of you. So we'll start with a self-sufficiency question from Christy.
The self-sufficiency changes are very exciting. Do you see any opportunities for keeping the changes that were made to streamline the application process or increase benefits after the pandemic ends?
All right, so can you guys hear me okay?
Yes.
Tap my finger this time. Apologize for that during my first presentation. So a lot of the processes that will be coming with our integrated eligibility system are the kinds of things that we will definitely be keeping, that streamline the application process for folks, give people access to multiple programs from one application, those kinds of things. We'll also be able to add additional things with integrated eligibility, such as verbal signatures and some of those things that we weren't able to do in our current systems. Unfortunately for us, I think the additional benefits on the SNAP side will all come to an end because they all require a federal waiver, and at some point, some federal waivers already have an end time. Others will definitely stop. As far as the daycare program changes that we were able to make, the employment-related daycare programs, that'll come down to money, and at this point, I don't believe there's enough money in the budget to continue things like the no co-pays and things like that. So I would be skeptical that those things can continue, although I know there are several work groups, including a task force with the legislature, looking at ways to improve childcare. So hopefully we'll continue to improve our programs as we go, but a lot of the changes that have come during this time are temporary.
And the next question is going to be for Mike McCormick.
This one is related to adult day programs. Are there guidelines being discussed to help people in-home services for elders who are not able to attend their usual programs, such as adult day programs? Will staff be able to visit people in home if they utilize PPE and protective measures? And do you see a slow rollout of being able to reopen day centers with limited numbers? It's a collection question.
That's a really good question. So the deal was, in exchange for financial support for the adult day providers, they had to have ongoing contact with all of the consumers that they used to serve through their adult day programs. And they were also required to identify any unmet needs. So if they were used to getting nutrition at the adult day center and they weren't getting that anymore, then assist in providing an alternative to that, providing an alternative to in-home services. And so that's the deal that we struck in support, in exchange for the financial support package. And yes, anyone can have face-to-face contact with an in-home consumer with the use of PPE.
All right, thanks, Mike. And then next up, Lilia. I have a question around developmental disabilities from Christy.
This question has some acronyms in it that Lilia may need to explain. Does the federal FMAP Medicaid match increase of 6.2% that was part of the CARES Act apply to the 1915K waiver and disability services?
Thank you for the question. Yes. Initially, so FMAP, federal Medicaid, federal matching, I forget what FMAP stands for, but it's basically a 6.2% increase in the amount of federal funds that the state of Oregon gets for its Medicaid programs through the K plan. Initially, CMS said that Oregon did not qualify because our services were under the K plan, which already got an additional 6%. And so their initial guidance out said that the state did not qualify for that additional 6.2%. But after a great deal of advocacy, both from states who were impacted by this and other entities, different organizations and groups in states that were impacted by this, CMS revised its guidance and did come out and say that yes, the states that use K plan for services, those services would also be eligible for the additional 6.2% match.
And next up, Christy, a question for vocational rehabilitation.
Yes, Keith. This question is, what is VR's plan related to providing pre-employment transition services while schools are closed?
Yeah, can everyone hear me? Yes, okay. So our plan is that we have contracts with over 120 school districts that employ individuals who are delivering those services. And currently we have communities of practice where we are providing training and lesson plans to those contracted providers in the school districts, who are then working directly with students and families to ensure that there is that service delivery model. We're also making a change to our summer work experience programs to transition them into be virtual pre-employment transition service delivery. So that's going to be a continuation of service directly to school students who are in that online virtual learning platform currently, then transitioning into summer activities with other contracted entities that are community-based organizations delivering those services this summer, and then ramping up into the fall, being able to hopefully be able to deliver those services in person again and be able to have those students engage directly one-on-one with staff.
Last but certainly not least, child welfare.
This one is related to home visits. In circumstances where a home visit is needed before reunification, are the home visits occurring, and can they be done virtually?
So we are really addressing that on a case-by-case basis, so that whatever can be done virtually is done, but there are pieces of the work that do have to be done in person, and with that then we work with our teams to make sure that they're practicing the protocols in order to ask the questions in regards to everyone's health, circumstance, and risk of exposure, and enter into the home with the necessary PPE.
And we have many more questions, so we'll turn them into a FAQ and post those on our website next week, along with the recording and transcript from today. So check that out on Monday or Tuesday of next week. And I just wanted to close by echoing Dan and Mike's comments. This team has been I'm going to get choked up, Mike. This team has been just an honor and a privilege to work with through the crisis, and for all of you as partners to know, have worked tirelessly for the last many weeks. It feels like a long time, but it really hasn't been. And we will continue to challenge ourselves to think outside the box and prioritize serving you and serving the people of Oregon in the best way that we can. So I just want to acknowledge my colleagues in this effort. And with that, be safe, be well. We know you want to know more from us, so stay tuned for some follow-up opportunities. Thanks, everybody.